My dear students, in this video you have to study about Pharmaceutical Chemistry-II. Chapter name is Central Nervous System Stimulants. The CNS refers to Central Nervous System, is highly complex in nature and consists of number of subunits and centers. So here the central nervous system is the main part of the human body which controls the vital functions of the body. So means the varieties or all the types of the body functions mainly controlled by the central nervous system. There are number of hormones released in our body system which are synthesized and acts through the transmitters of the nerve endings. So here the nervous system have the structural and functional units of called neurons, which are transmits the all the signals from one body system to the another body system through the nerve endings. So these hormones are called bioamines, and through these the normal functions of the body are maintained. So if you have the chemicals composition of hormones have the bioamines, and these are normal functions of the body can be maintained in the body. So the endocrine gland system of our body can secrete the chemical substance which are mainly maintaining the all the types of the body functions. There are many drugs which act selectively or in general on the centers of central nervous system to varying extents in their intensity and duration of action. So all the types of the drugs can act on the central nervous system which may be extends in their intensity and duration of action. So all the types of the drugs can be very useful to the body system which can be controlled by the CNS. So the normal activity of the central nervous system can be helps through the drugs. Some drugs stimulate the functions of the central nervous system while other depress it. So there is two functions of the drugs. So the drugs can stimulate the functions of the central nervous system, means which will helps to make the more active work in the body by the central nervous system. Some drugs are depress the functions of the body. So these are the two main functions of the drugs. Thus the stimulants of the central nervous system are called analeptic drugs, means which will helps to make the work faster, means it starts to stimulate the central nervous system in the body. That type of the drugs are called analeptic drugs, so which restore the depressed functions of the central nervous system, means so which become active, makes the active in the all the types of the body functions. So drugs are useful in variety of clinical conditions. So mainly the drugs are very applicable and useful in variety of the clinical conditions. Another category of drugs are the antidepressants. So these antidepressants are also the medicine. So these drugs reverse profound mental depressions and bring about the feeling of well-being and restore confidence in the patients. So it become free from the depressant. So such type of the drugs are called as antidepressants. So here the drugs reverse profound mental depressions, means it become refresh the mental activity and bring about the feelings of well-being and restore the confidence in the patients. So such type of drugs are called as antidepressants. So the next, psychoactive drugs. These drugs are a category of agents which alter the behavior of patients who are mentally ill. So some of the people have the mental depressions or mentally they have a not working properly. Such type of the patients can have the drugs like psychoactive drugs, so which can be helps to mentally refreshness. Then anti-psychotic drugs and their mental related drugs, you can have the compounds belong to this category also, that is also called as anti-psychotic drugs. So here the students, so these are the such type of the drugs like analeptic drugs, then antidepressants, and one more important drugs like psychoactive drugs and anti-psychotic drugs. So these drugs are having the chemical reactions and their mechanical work can be helps to the central nervous system more active and active. So in the depressant categories, the most potent drugs are the general anesthetic drugs. So here the anesthetic drugs can be depressant drugs which bring about the profound depression of central nervous system functions and bring about unconsciousness in patients. So this is the more functions regarding the uh, functions of CNS, central nervous system. The profound depression is also one of the more functions. Then it brings about unconsciousness in patients when you have the general type of the medicine like anesthetic medicines. So when such type of the dosage can be administered in our body system, so which brings the unconsciousness as well as depressedness in the body. Then next you have the hypnotic sedatives is another category of CNS depressant. So means it is also hypnotic some sedatives or hypnotic medicines we call it as. So it also the depress the central nervous system, means it will be slow down the working function of the central nervous system, so which claim the nerves and produce sleep or sleepy conditions, means you have taking the such type of the drugs in the body, it will become sleepy in mood or sleeper in condition. So these agents produce their action by depressing many centers of the central nervous system and thus act in the general way. These are having the depressant drugs like anesthetic drugs, and another one is called as hypnotic sedatives. So nowadays the more patients depends on such type of the drugs, we have feel relief on taking such type of the medicines. So next we have the skeletal muscle relaxants and tranquilizing agents. So this type of the drugs that can be helpful to control the body pains. Our bones can be skeletal muscle relaxants and tranquilizing agents are the category of CNS depressants, so which act as neurosedatives. So these type of the drugs can be mainly helps to the CNS depressants also. Then they mainly act on the neurosedatives which produce the skeletal muscle relaxation. So if you have the body skeletal pains, it can be relaxation, which can be act as a pain relieving, so acting through the central mechanism and bring about the tranquilizing effect in the body. So in patients, so anticoagulants are the drugs that prevent or diminish the severity of epilepsy or convulsive seizures. That type of the effect can be controlled by the some of the medicines in the on the central nervous system. So this action is brought through the mechanism of inculcating the central nervous system, the analgesic which relieve pain by increasing the pain threshold. So all the types of the drugs like skeletal relaxants, otherwise some of them have to tranquilizing effect on the body patients, which can be relieving the or preventing the or diminish the severity of the epilepsy as well as convulsive seizures. Such type of the whatever the things in the human body can be affected by the central nervous system by such type of the drugs, is it? So here the some of the mechanism at the subcortical and midbrain region of the central nervous system. So the antipyretic and analgesic drugs which reduce fever and bring the elevated body temperature to normal also, so which can be very helpful to reduce the body temperature when the temperature is increasing during the fever. Such type of the medicines like antipyretic or analgesic drugs can be control the body temperature, it become also normal in condition. So also act through the midbrain subcortical region, so through the central nervous system. So here the some of the drugs can mentioned above. So all the types of the drugs can be producing different pharmacological response which are partly acting through the central nervous system mechanism. So mainly the central nervous system mechanism or functions or whatever the working function of the central nervous system can be depends on the all the types of the medicines which are useful to the activity of the central nervous system. So that all the drugs can be act as a pharmacological responses, mainly it can be controlling the all the types of the body activity functions. The central nervous system stimulants. So in the previous knowledge about the central nervous system stimulants, the drugs which increase the activities of various functions of the central nervous system are called as central nervous system stimulants. Means the more active body system is central nervous system, so which become increase the activities all the types of the functions by the using the some stimulants or some medicines which can be helps to stimulant in our body, so which can be act on the central nervous system. So they are called as central nervous system stimulants. So these are also called as analeptic drugs also. So such type of the drugs can be used as a analeptic drugs which can be stimulant or stimulus the central nervous system. So as they lessen narcosis and bring about respiratory stimulation, means which also helps to the function more functioning of the respiratory functions. So these drugs restore the depressed functions of central nervous system. So if their central nervous system is not working properly, so at the time, so such type of the drugs, that stimulant increasing drugs, can restore the depressed functions of the central nervous system. Another category of agents are called as psychomotor stimulants. These psychomotor stimulants also very important drugs, can be helps to increase the functions of the central nervous system. With they are also used in mental depression. So those patients which are having the mentally depressed, or they have mentally not active in condition, so we have the medicines called as psychomotor stimulant drugs can be applicable for the central nervous system. So here the central nervous system stimulants have a number of therapeutic applications in the medical field. They are useful in treatment of narcosis to overcome the depressive effect of the depressant drugs. So the system can be stimulants mainly. The treatment of narcosis to the overcome the depressive effect of depressant drugs. So that is very important functions. Then they are useful as respiratory stimulants. So this such type of the drugs can be useful as respiratory stimulants. So this action is brought about through the chemoreceptors and the vasomotor centers. So here the some of the drugs also act as on sensory areas of the brain, can be controlled by the so many effects of the body functions, and increase the mental alertness and produce a condition of wakefulness. So here the some of the drugs can be helps to stimulus the sensory organs, so it can be depends on the functions of the central nervous system. Means here the functions of the brain can be increases, then increase the mental alertness by use of the such type of the medicines and produce the conditions of wakefulness. So means it will be also the one of the important conditions of the central nervous system. So the drugs are called as anorelaxinic drugs, which are useful as appetite controllers. So here the all the types of the drugs belonging to the various pharmacological or pharmacological classes, so which can be exhibit pronounced stimulatory effects on the central nervous system, which are helps to the body functions regularly restores in the patients. So the cocaine, the local anesthetic, act as a in our body. Then atropine as a parasympathetic active in condition. Ephedrine and amphetamine is also sympathomimetic, as well as corticoids. So many drugs can be applicable for the central nervous system can more and more activeness. Then selective central nervous system can be stimulants, can mainly be divided into two major classes. So no naturally occurring drugs, then xanthine derivatives, and second one is synthetic agent. So means the natural occurring drugs also available, as well as the synthetic drugs. These are the two categories of the central nervous system stimulant medicines. So my dear student, so this is about the central nervous system stimulants. So in the next video we have the study about the some of the important drugs of the central nervous system stimulants. So here we have any doubts or any clarification of the this video, you have go through the contact with the lectures. Thank you.